are welcome, sweetie. You are so welcome. We were so anxious for you to wake up because we heard how nice and fun you are. All the nurses said that, so.
Yay!
Yay for you. Yay for you. Okay, so now where are we?
The antibiotic, yeah.
And now the anti-inflammatory, Celebrex. It's not available generically, so it actually says Celebrex.
Okay.
And she'll take it twice a day for 5 days also. So both of these drugs that start tomorrow are only for 5 days.
Okay.
Finish them. Yes. And then fill only if needed. She didn't have to pick up anything for nausea. We have a really low incidence of it, so if you don't use this, just save it.
Okay.
Okay? And it dissolves on her tongue without water should she feel nauseated.
Okay.
It gets into her system in about 8 seconds. So here's the scoop. No aspirin, Motrin, Advil, or Aleve for the next 2 weeks. And
Yes, it is. How you doing there, sunshine?
she is sunny.
Look how good you look.
You're like magic.
Well, they're not magic yet. Give it a few weeks.
I checked. They look beautiful.
Well, they'll be
Oh
better.
my gosh.
They'll be better. They're beautiful, but they'll be better in a few weeks.
She must have been
In a
sleep
few
deprived.
months.
She slept for an hour straight in here.
Oh,
1
that's
hour
usually-
straight.
That's
I
pretty.
don't even remember.
We love that you don't.
Yeah.
I don't even feel the pain.
Vicki and I are going to put a little note on you that we loved you up in
Gosh,
recovery.
you're like,
It's good anesthesia. It really is. We've got some numbing medicine in the pocket. Remember that pill you took beforehand? It's all good.
She just took it
So
again.
you just take it easy, relax. We don't want bleeding, okay?
Yeah.
yeah, thank you so much.
You're welcome. We'll talk to you tomorrow in detail.
You
Okay.
have magic hands.
We pray over them every day. If nausea or vomiting occurs, I want you to stop giving her 1, 2, 3, and 4. I want you to stop those 4 drugs. Just give her an anti-nausea medicine. And don't resume it, any of them, until she can keep down water and crackers. And you know, the culprit for nausea is almost always the Vicodin. My other little tidbit is
So if she becomes nauseous, just give her this and then stop these over
yes,
here. Okay.
completely.
Completely.
Until she can
hold down food and
yes,
water.
yes. And then, what was I going to say? The culprit's Vicodin. And in the morning when she wakes up, don't necessarily give her the Keflex, the antibiotic, and the pain medicine at the exact same moment. Start with the
Okay.
Keflex, let her get her bearings, and then maybe an hour or so later, if she
Okay.
feels like she needs it, you can give her, and start with a half.
Perfect.
Okay? Perfect. Any questions? You know there's
Nope.
a quiz. Okay. So here we go. Take medications as prescribed. Finish all those antibiotics. Call us if you notice. Wasn't it fun?
That's so easy.
So easy. Call us if you notice progressive swelling, bleeding, or soreness, especially if it seems to be in just one breast. So I'm looking for early signs of internal bleeding. If that happens, one breast will swell twice as much as the other. The pain will be escalating. The skin will be tight and shiny. If that happens, you give us a call. Our phone number is right here.
And I know he's going on vacation, but I do have his number too.
Yes, and he's not going on vacation until Wednesday.
Okay.
And the likelihood of a bleed is worst, most in the first 24 hours.
24.
Yeah, so Dr. Tholen. Did you make an appointment for tomorrow?
421s. That was as big as he could go. Because it got 2 feet in there. If he went any bigger.
There's his home phone number. Did you make an appointment for her to come back tomorrow yet?
No, I haven't.
I'll do that for you.
Okay. Would it be best if I take off tomorrow from work?
See how it is.
Okay.
You know, see how she is tonight. You'll be shocked at how awake and good she is.
Okay.
Our rule is 24 hours with supervision. So, you know, it starts now at
Okay.
noon. So, if you can take off till noon, that would
Yeah,
be
maybe.
Turn for recheck tomorrow.
Yeah, let's take this out of here.
Hey,
Oh my god.
Right. It's necessary that she stay quiet. The number one cause of postoperative bleeding, too much activity too soon. So she has to cool her jets. It's not like orthopedic surgery, you know, where they cheer you on for getting active sooner than expected. Ours is just a tried and true formula. She's off to a great start. You don't want to do anything to have a problem with
Okay.
bleeding.
I'll just
Sleep
keep her on the
elevated,
bed.
right. Keep her elevated on 2 pillows, kind of
Okay.
not as high as she is now, just up on 2 pillows. For the next week or so, that diminishes swell. You can. I'm done. You can take it
Yeah, I
all
was
off.
going to ask. Just getting tangled.
What the hell
Less
is
swelling
that
means
for?
less soreness. No ice to her chest, don't be tempted, and also no heating pads. Keep the dressings intact just like they are now. Tomorrow's the great unveiling. He'll take off the ace bandage, he'll take off the dressings underneath it. She'll get a good look at it, and then they'll probably put a couple of pads underneath it and put the ace bandage back on. She'll be able to shower though on Wednesday. Start out with liquids, work up to a light meal tonight. I want you to feed her like she has the flu for 24
Okay.
hours. No alcoholic beverages, interferes first with her anesthetic and second with her pain medicine. So 5 days minimal, no alcohol. Beyond 5 days, if she's still taking her pain medicine.
Yeah, we don't drink much. So
Okay, so now you don't drink at all.
Not at all.
No driving the car, minimum 48 hours for anesthesia to get out of her system. Again, she has to be off her pain medicine before she starts to
Yeah.
drive. And obviously I don't want her driving
I'm
if
so shocked right now.
Robaxin makes her sleepy.
Okay.
No strenuous activities that involve the use of her arms. This is the princess clause, or in her case, the queen clause.
The queen one, yeah.
It's a pass on housework. No vacuuming, grocery bags, laundry baskets, no taking out the garbage. Remind her
Amazing.
not to raise her arm above her head, elbow lower than her shoulder all the
I
time.
can't be here right now. Like, I just took a nap.
You did take a nap, a good nap. You even had a dream, you told us.
I told you guys that.
Yep. Yep. So, the thing I want you to remember most today is reminding her to cross her arms over her chest when she gets up out of chairs. We all push with our arms when we get up, and it's really hard on the pec muscles, so don't let her do that. Remind her. Tomorrow you won't have to remind her because it hurts. No lifting anything greater than 5 pounds for 2 weeks, and we're strict about that. As a point of reference, a gallon of milk full weighs 8 pounds. Tracy will call you tonight to see how things are going.
Okay.
Don't hesitate to call us. I'll make that appointment for you.
Perfect.
And then, these numbers are answered 24 hours a day. After hours answering service picks up on them. And if answering service pages the doctor and they don't call you back quick enough, then you call direct to the answering service and ask them to be paged again.
Okay.
All right? That's my story on
Okay.
that. Anytime you have a medical device implanted, you should have a record of what's inside of you.
Okay.
We have a record of this. Allergan, who makes the implant, has a record, and she should have a copy.
Okay.
The serial numbers are specific to her implants alone. And again, she might ask you 1,000 times what size we put in, 421.
Yep.
Okay, that's just for you guys.
Perfect.
And then this is a copy of Allergan, who makes the implant. Their informed consent. We have a copy, and you guys should. And then this final page, Allergan will stand behind the implant for the life of the implant, but for 10 years they'll give you $3,500 toward operating room and anesthesia costs should she ever require surgery directly related to the implants, like a rupture. And they ask that you answer these 3 questions. It